President of Maharashtra Ophthalm Society. He has been very active member of the different societies, a very popular person. One of the chronic conference goers. Wherever you go to any conference, you'll find him. A very near and dear person. And then we feel delighted to meet him anytime, anywhere. So, you're welcome, sir. Please come and give your talk.
Thanks, Dr. Kashyap, and the dignitaries on the dais and off the dais. Post afternoon, of course, everybody must be feeling a little sleepy. And then I'm going to speak on a very odd topic, solo practice. Well, nowadays everybody wants group practice because of the fundings and all. So actually I had given a different topic, but Dr. Partha thought this is suitable. And so I'll be speaking on this topic. There are certain good features about this. Yeah, na? This one. Kude kude jate? Hai? Aage piche kidhar ja? Haan, abhi ja raha hai. Yeah. So the most important part, I've been practicing as a solo practitioner for the last 35 years now. And of course, I'm pretty happy with it. So why? The reasons are, one is you are absolutely autonomous. Apna malik hai. So you have the responsibility, of course, to determine all the aspects and make all the decisions. These choices extend from the equipment, procurement, and hiring and firing to the hours of operation and scheduling decisions, and give the advantage of being able to design, then grow, and then develop your practice the way you like. That is very important. If you are in an organization, you definitely have to follow the rules and regulations what they have set in. Here you have a definite advantage, how to go about it. That's why I said you are in charge, and when I say you are in charge, I mean you are in charge of everything. Your rate, your schedule, your branding, what clients you would like to work with, what are your target patients. You have full authority over every aspect of your business. Most important is personal bonding. If you see, I am also working in Sahyadri Hospital. There is one of the chains of hospitals which are in Pune, run by Dr. Charudat Apte. There you see absolutely ये डॉक्टर ने हमको देखा ऐसा नहीं सह्याद्री हॉस्पिटल में हम जाके आए they don't even know the name of the doctors. Here when it is an individual practice, it makes a lot of difference. You are sitting, you give more chair time there also. You see to it that the person, because ultimately it's going to get you the further footfalls. So a smaller patient base is there, so you have the opportunity to develop close and personal relationship with your patients and staff, and provide your unique style of medical care the way you would like to. Again, there are certain restrictions in a corporate hospital. If you're working, you have to follow a set guidelines what they have set. So here again, traditional doctor-patient relationship which helps will provide important reassurance to the patient that the physician is acting in his best interest. This is very important again, which is again lost. अभी बोलते हैं ना भाई डॉक्टर को टाइम ही नहीं हमारे लिए, आया बात करता है बोल दिया चश्मा है पहनो finish. Here you have spend a chair time, you develop a specific bonding between yourself and the patient. This unique bond generates trust, which leads to further adherence to a treatment plan. Whatever you suggest, उनको फिर विश्वास भी आ जाता है. Work-life balance. You have your own timetable. You set up your work hours as per your convenience and can plan your OPD and the OT timing as per your requirements. So you gel very well with your family and take time out as and when required. Today I'm out. Of course, we have a backup there, but then I have scheduled my this thing. If you are in a corporate, leave low, dete hai ki nahi, whether you are an honorary, you are supposed to inform. So all these bindings are not there here, and you have that flexibility of your time schedule. The cost control. Here again, you have to plan it out. कहाँ discount देना है, किसी को free करना है, कितना charge करना है कि you have more footfalls. So in a solo setup, financial management is totally in your hand, doing away with unnecessary expenses. Again, I'll give you an example of where I'm working in a corporate hospital. There are certain instruments which are not used for days and months together, and they've invested lakhs in that. They say, we have 5 centers, we are going to shift from this to the other one, just because it's lying idle. So there we again have a control. भाई जब तुम खुद करते हो वही क्यों डालूँ मैं, उसका पैसे है मुझे return of investment, then only I'll be putting it. So that is one more plus point of a solo practice. You have a stepwise budgeting which can be properly done as the reins are in your hands. Initially buying only of necessary equipment. When I started my practice years back, absolutely we had no place, I had no scooter, no vehicle to move around, and no instruments absolutely. So I had to, what were the bare essentials I had to put in, buy through a loan, not even cash in hand. So that is how we started the practice, and that is what I would say in pearls of practice. Whatever is essential, either the pharma people are going to say, update karo, upgrade karo, but is it really required? Yesterday we had a session on the ARC people. There we had two things: minimal budgeting or a moderate budgeting, and then you have upgrading at every step. Any instrument coming up, ले लो. हाँ, बड़ा institute है, they are ready to buy, but again they are going to ask you, are you going to use it? Is the use frequent? Only then we are going to invest for XYZ equipment. Here again you have everything in your hand. So adding newer and advanced equipment whenever the finances are good. I would again say that as you advance, depend less on loans and have your own money put. If it is, especially the medical loans are now available off the hand. Everybody is trying to call you every day. Bhai sahab, humko dena hai aapko. So don't fall for the prey. See what your requirements are and then only invest. Best suitable for solo. Where do you start this? So this will work. The solo practice will work not in the absolute metros, where it is becoming difficult, where the chains of hospitals like ASG, CFS, Agarwal, everything is coming up. They have their own set standards and they have their own marketing team. Here we don't review. Market is, main is you have the digital platform where you can do all the marketing solo. You have your PRO moving around, and of course, word by mouth is always there. So best place of practice is a suburban area if you're in a metro, or in one of the rural or the mid-taluka place. It's mainly very suitable for the solo practice. I'll give you again an example of my classmate. He is practicing in Sangamner. He has a footfall of almost 150 patients a day. In our private, I don't know if Parikshit will agree in that, 30, 40, 50 हो गया तो बहुत बड़ा OPD चल रहा है. That is what we have in the metros. Where in the periphery, it is easy for a person who is ordinarily set up, who has got ordinary equipment, to have a footfall of at least 100, 150 patients. So that is why again I would say for best suitable place is a rural area, semi-rural, or a district or a taluka place or a suburban area. Earnings. As again your charges are kept in such a way to maximize your earnings. You do not have to follow the hospital schedule of charges. If I do a cataract in again a corporate hospital, the hospital cuts off 15-20%, another 10-15% goes in TDS, and the rest you get. Here you get everything. Ultimately you work out your budgeting and pay the taxes accordingly. So there is almost a difference of about 25 to 30% on your earnings when you do a solo practice. You go to a corporate, they not charging per patient, but overall they cut off 15 to 25%. So providing concession and discounts to have, by OPD में discount दे दो, operative में आप cover कर लो. So this is all the strategies which you can follow in the practice, all the forays to win the goodwill of the patient. Financial controller again, to cut costs by streamlining the expenses. The earnings are there, then again you have to cut down the expenses. कहाँ चाहिए भाई 5 staff की जरूरत नहीं है, 2 में बिठाओ, multifunction कर लो उसको, and see that it works according to your schedule and you maximize on your earnings. Again, there is a novelty. You can have creative, the way I am attending conferences, you have diverse and improper elements of your solo practice which are welcome to those that like and mix up the daily work routine. And there is less burnout. In a hospital practice, 9 to 5 बैठना ही पड़ता है, patient एक हो या 2 हो. इधर तो you can reschedule or this thing, by मैं इधर hospital जाके आता हूँ. I go to a charitable institute, this, that, everything you can fill it up in that. So maximum time management can be done in a solo practice while you are stuck up in a corporate setup. You can be creative in all aspects of private practice. So it is the 6th dimension. You can learn more of the clinical work, expand your knowledge to learn multiple aspects like finance, running business and marketing. During the COVID days, I had started the financial series. I am the president of the Maharashtra Ophthalmological Society. We have 21 committees. So other than academic, I have got another 20 committees where we are working on each aspect to see that the footfalls of the most peripheral surgeons in Maharashtra have a good earning by doing just rescheduling the way your finances, what you earn, tax budgeting, tax debit, whatever it is, the tax credit, how do you do it So all these small little things, whether you really invest in stocks, when do you invest, how much you invest, what percentage of your money goes in this, all this you have the independence if you have a solo practice. So the potential to create a real ideal work culture is with you. So a big thank you for giving me time once again, and I hope I've tried to put across the time about solo practice. We can, especially in the rural area, the semi-rural, you can definitely think as the change are going, they are of course going to penetrate the most periphery of the every state. So take a call accordingly and start with a solo practice the way I've just given you an insight, and wish you all the best. Thank you very much, sir.